I feel like the way we think about health as a nation needs to change, because we're just thinking about when we get sick. We don't ever think about health when we're well. Nobody ever thinks like, oh, I should really take this vitamin because like I'm healthy right now. Everybody's like, oh, I need to take medicine because I'm sick.
I think a lot of household medications are overused just because, oh, I got a little headache. How about some ibuprofen? Just stuff like that.
No, we need to do these things and prep our body for being sick. We need to do these things to prep our body for being aged. Like, everybody ages, and like this all affects how you age. Like, some people die younger because they don't take care of their bodies when they're younger.
Do you think there are times when it's needed, like really needed, for the patient's well-being?
Yeah, I think there is times where it's needed that although there are times like that psychiatrists and other professionals need to really look into their patients before subscribing.
I mean, like, ultimately, I feel like what they prescribe, it does work. So I don't want to get that confused, but I feel like there might be a cheaper alternative. You know what I mean? Because back in the day, they didn't have Zilafram, chlorine, you know what I mean? They didn't have all that. So I feel like there's a cheaper alternative to it.
Yeah, so how do you think they maintained life without Zilafram chlorine?
Bro, just remedies, just old stuff, bro. Plants, nature, Mother Nature.
Do you think that all natural remedies, treatments should be ruled out, or do you think there is a place for that?
There is a place for that. That's actually what my mom does. She's a pharmacist, but she specializes in bioidentical hormone restoration treatment. So instead of the Premarin, which is those pills, it's literally pregnant mare urine. It's horse pee, and it causes breast cancer, and we're putting that in women's bodies as a fake progestin. Okay, so my mom uses plant-based or soy-based for her BHRT studies, and she replaces the progesterone.
Do you think that pharmaceutical companies are interested in the health of their patients?
Yeah, I do. I feel like they're also into money also, though. You know what I mean? So that's where it kind of, I feel like it's a weird balance between the two.
It's because like medical companies, why would we get you better? Why we cure cancer for everyone, where we could benefit off of cancer? And chemo costs so much, like it's ridiculous. Actually, my grandmother has cancer. My grandmother has leukemia. She thinks that one of the things that gave her cancer is actually like those giant brick phones, because she used to work for the welfare department, and those were her work phones, and they created a huge knot on her neck. So she thinks that maybe one of the things, we don't know if that was what it was, but like some of these new things that we haven't had for a long time, we don't know the long-term effects of what they are doing to our bodies and what they're doing to us as a whole.
The more technology, the more kind of smarter we get, we're going to start bringing in different kind of chemicals, and everything has a con. So it may have its pros, but it may also have a con, and who knows what that could be.
I think a great example of that is gluten. It's so common now, but gluten is actually poisonous to humans. Not in a sense that, you're gonna die, but gluten is horrible for humans, and we keep eating it because it's just the normal now. I want a cheeseburger. Heck yeah.